It's Mari McInerney from Croaky here at Safer Care Victoria's Giant Steps Conference, and I'm here with Belinda. Would you be able to introduce yourself, please?
So, hi Mari, I'm Belinda Scott. I'm the Chief Executive at Djerriwarrh Health Service.
Thanks very much. Now, you've just done a presentation, and I'm going to ask you if you could perhaps put it in context about what you presented on and how it actually has led to us being here today.
Yeah, so today I presented on rebuilding from failure, which is really the Djerriwarrh story of recovery and how we've gone from the catastrophic failures which were uncovered in 2015 and how we've changed our organisation to be to provide safe, high quality care.
Can I just go in first and say where is Djerriwarrh based?
So Djerriwarrh covers the catchment of Bacchus Marsh, Melton and Caroline Springs.
And can you talk about what that event was there?
Yeah, so the catastrophic failures identified by the Minister for Health in October 2015 were the result of 10 stillbirths in 2013-14 and realising that 7 of them were potentially avoidable.
And that caused obviously deep pain and great concern across the whole health sector.
It did, and also for our community. We're a small town in many ways and people know people. 75% of my staff live and work in the catchment, so they knew patients, but they also deeply affected themselves.
So what impact did that have?
I think really for the community, and for the health service, it was deeply distressing. And from there, what we've had to do is look after our people as much as rebuild the faith in the health service.
Can you say what you started there 18 months ago?
18 months ago.
What was it like when you walked through the door there?
I'd wondered if I'd made the right decision because it was an organisation still quite distressed by the events. We were 100 days from accreditation. The sort of 4 key areas that they identified as part of the review was around governance failure, critical infrastructure lacking, the workforce capability, and also the confidence in the service, if you like.
Which
and
manifested then in what way? How did these unavoidable deaths happen? Sorry, avoidable.
So really it was about the infrastructure. We were birthing in 2013-14 and 14-15 we birthed 888 women. 888 women, our nearest peer was 301 babies. That should have raised 2.5 times, should have raised an alarm, should have said something wasn't quite right in a service of our size. We'd outgrown our infrastructure and the capability wasn't what it should have been. It's a 1957 hospital, and many of the features of the 1957 hospital exist today.
So what did you go about doing to rebuild from failure as you've just presented on?
So I think it's really important to acknowledge that this is not me rebuilding from failure. This is a team. I'm here presenting today to rewrite the narrative because the opening for every conference over the last 2 years has really been about the failures at Djerriwarrh. And it's, for my people, there was a lot of commentary about, the capability wasn't what it should be. But to come to a conference and then introduce yourself in a room like this to people that you're sitting with and say, hi, I'm Belinda and I work at Djerriwarrh, was really difficult. Because people, made judgments about you without knowing one thing about you. I've been there for 18 months. Many people, this has been a 4-year journey. But what we've done is we've invested in our people, we've removed the barriers to attending education, we've tried to instill a culture of lifelong learning, we've rebuilt the infrastructure, and we have also really fixed our governance. And really focused on improving our governance and everyone's understanding of governance.
And how do you know that what you're doing is working?
So I presented a whole lot of data in the session. We've really simplified things in terms of making sure that information goes from where it should. We have a look at everything annually. We have set work planners to make sure the right things are going to the right committees at the right time. We look at our patients, we look at our staff, we look at the way our systems and processes work. And really have a critical eye for that. We're not afraid to make change if we see it's not working.
Where did you learn from to work out what to do?
I think for me, I've probably in my last few roles, it was really about taking services that weren't really working well, a pocket of, a problem, and then turning it around. So I feel like my last few jobs might have prepared me well for this. And every health service has issues and areas of risk, This is not a story of one health service failure. There were many health services who made changes following the Targeting Zero report.
And that was, of course, why the connection is with the conferences here, was that the Targeting Zero report by Stephen Duckett, led by him, led to the creation of Safer Care Victoria. Yeah. What about for the community, for the patients? Has faith been restored?
Yeah, so I presented today some really positive things and how I measure that the community does have faith in our health service. We have over 250 volunteers active this week. We have had $1.2 million donated by Our Ladies Auxiliary in the last 4 years towards our capital projects. They raise their money through the op shop in town. So, it's the community supporting them to support us. Our compliments outweigh our complaints 2 to 1. And there's 600 women who are going to birth in our service this year. Now, back in 2014-15, when it was 888, and there were 30% of women who were immediately transferred because they were outside our capacity. If you do the maths, then that equals 622. So we're back to the right level of consumer confidence and use of our service.
What do you say? Do patients still come in and say, how do I know that my baby is going to be safe?
Not really. We enjoy enormous support from the community, like I say. If anybody's got those doubts, they're raising it in the clinic if they're a pregnant woman, well before they make it inside the hospital. But the staff, it's the confidence you have in the people who are looking after you. We've had women transfer from other health services because they've moved into the area, or the other service might be a little overburdened and asked us to take some patients. And their reports that we've had an amazing experience, and they weren't worried. They asked the questions. They were informed. We're a completely different health service. At the time, we didn't have obstetricians. We didn't have anaesthetists. We didn't have paediatricians on staff. This year, we just opened our special care nursery. Last year, 35 babies were transferred away from mum in the first 24 hours because they needed that care. Those babies can stay with us safely. Got an expert team and brand new equipment to look after them.
And how do you measure the faith of staff?
Yeah, it's an interesting question. Certainly if you're looking at long-term staff, we've had a reduction in long-term staff. Not sure that's a bad thing. If the workforce is aged over 50 and 40% are, that could be just people retiring. I think it's the fact that we have, for every one job we put up, we get numerous applications. We have, just recently we had a job we put up, got 117 applicants for one job. It's outstanding. One of the things being in a growth corridor is people want to live and work close to home, and people are coming to work for us.
What about in terms of government and systemic change? Did you get the support you need, and is there anything you're looking for now?
I think that's always a challenge, helping a little health service. What does it need? Some of it has to come from within. I think the systemic changes that have been made are overall effective. I think the endorsing of Safer Care Victoria, to really focus on patient safety and patient-centred care is, a giant step forward for Victoria.
Anything else you presented on that you want to mention?
Really, I focused on thanking the team because, whilst I presented today, it really was a team effort. I showcased a video from the health service showing that we're a welcoming place to anyone who comes through its doors.
And what would be the lessons to other health services? What do you look out for to avoid this? And we've heard some discussions here about whether you can be totally zero.
Yeah.
So
I think you never have to stop asking why. I think that you can't be complacent. You have to ask, could this happen to me? And you have to have a natural level of curiosity, and don't accept the first answer you're given.
Which is often what? Why is that?
Oh, I think because, not necessarily in this context, but if you're given an answer to say, it was unavoidable, or, that's just how it happened, or this didn't work, ask the next why, and what can we do to fix it,
And can you bring that as a culture to the whole service?
Yeah, absolutely. I think, trust is a real issue in a health service that's been through this much distress and had this much adversity. We're working really hard every day for the people to trust us, to share their, to put down their baggage, share their story, and then take a step forward. And that's been our focus.
Fantastic. Thank you very much, Belinda.
No worries.